Hello, my name is Desiree Stringer, and this is my positions check-off. And when you go into a patient's room, you want to knock first, and then you want to close the door after you open it and go in for privacy purposes. When you go in, you want to introduce yourself and be like, hey, my name is Desiree Stringer, and I'll be your student nurse today. What is your name, and what is your birthday? You'll get those two informations from it, and then you'll check the wristband to make sure. You'll check your records, and then you will perform hand hygiene, and then you'll tell the patient we'll be doing positions today, and you're going to be telling them supine, prone, and lateral lay are the positions that we're doing today. And you'll see if they're okay, if they're comfortable, and make sure that the patient is not in pain or anything when you're doing these. You want to start by the supine position. This is when you're laying in the bed, facing upwards on your back, like this. You will have a pillow at under your head, neck, and the top of your shoulders. You will also, sometimes you'll have a pillow under your forearms, and then you'll have a towel roll in your hands under the lower of your back and then under your thighs. This position right here is usually for patients who are just getting out of surgery or some that are in bed resting. And then you go to your prone position. Your prone position is when you're laying on your abdomen and you're facing down, like this. And you can have your head on either side of you, so it would be looking like this. And also, some patients think it's more comfortable to have one hand or both hands beside their head as they lay. This is a rare positioning because it will constrict your breathing, because you're laying on your chest, is not allowing the airway to come through as good as it usually does. It starts hypertension in your back and also foot drop. So you want to make sure that you have a pillow at your shins to prevent that from happening. You also want a pillow at your head and your abdomen area to help support the patient in that position. And then the last position we'll be doing is side laying or lateral laying, same thing. You're going to lay on your side, kind of like this. And then you're going to have a pillow under your head, your neck, and your upper arm. And then you would have your top leg in front of your leg closest to the bed, and you would have a pillow between that leg as well. This position also stops pressure in your sacrum. And then you also want to make sure you change positions many times when a patient is in the hospital, because that can form bed sores or stiffness in that patient. When you're done positioning the patient, you want to make sure that they're comfortable, that their call light is in reach, and that everything is fine with them. And then when you get done, before you leave, you want to wash your hands and check everything in your charts.